Okay, Nicole, so go ahead and walk me through the symptoms that you've been having.
So I'm just having some back pain, and
Okay.
more frequently so I've been doing more hip hop, more reggaeton classes. So
Okay.
I've been using my back a lot, and yeah, I go for my 9 to 5, sitting down, and then 3 times a week maybe dancing. So I've just been straining it a little bit.
Okay. All right, so you're experiencing some strain. So it sounds like you're doing a lot of movement, a lot of exercise. Can you tell me like where in the back the pain is centralized, or is it kind of all over?
It's more in the middle.
Middle, okay. So here, I'm sorry, my hands are very cold.
Yeah,
So
like
sorry.
right there.
Okay. So around here?
Oh yeah, the pain is definitely there,
Okay, what about along the spine? Have you noticed any issues? I'm going to go ahead and just palpate on both sides of the spine. Any issues as I go down just the top? Or is it mostly in the central lower back?
Oh, right there, yeah, the central area.
Okay. All right. And would you say that this pain is dull or sharp or throbbing?
Throbbing and aching.
Aching. Okay. And it hurts kind of all throughout the day, or does it hurt at any specific time of the day, like more in the morning or at night?
I would say at the end of the day, at night, especially after the exercise.
Okay. All right. I'm going to be doing a detailed assessment of your back. I'm going to be testing your spine mobility, and then we'll determine there what treatment might be appropriate for you, okay?
Okay.
All right. So just try to relax. I'm just going to be palpating your spinal discs, okay? Let me know if you feel any sharp pain. Of course, it's going to be hurting more in the middle, but if you feel any sharp shooting pain, go ahead and say so. Okay. So I'm feeling a bit of inflammation around C4. Yeah. Okay. Your spine seems to be well aligned. I don't see any signs of asymmetry, but I'll be measuring for that too. Okay. Do you pretty much dance every day, or do you allow yourself time for recovery?
I recover like maybe every other day, so maybe I dance about like 3 times a week, I would say.
Okay. All right. I'm feeling a little bit more inflammation on the right side, so I'll be focusing on that. I know my fingers feel cold, but I'm going to run them down your back, all right? So from here to here. Let me know if the temperature and the texture of my fingers feels the same as I drag them down, or if you feel numbness at any point.
Right there, it feels a little numb.
Feels a little in the midsection. Okay.
Yeah, something is really off.
Okay. Definitely. Okay. So numbness here.
Yeah.
All right. I'm going to be doing a sharper dull test. I just want to assess the numbness a little bit more, okay? So So you're going to feel a sharp sensation here. Do you feel that?
Yeah.
Okay, and this is going to feel dull.
Okay.
All right. So go ahead and say sharp or dull, or if you don't feel anything at all, let me know that too. Or if you feel maybe the sharp a little bit less, but you still kind of feel it, just communicate that with me as well. Okay. So.
Sharp.
Okay.
Dull. Dull. Sharp. Sharp, I think.
Okay, but it was a little bit harder to tell.
Yeah, a little
Okay.
harder.
Okay.
Dull.
Okay.
Sharp. Dull. Sharp. Sharp.
Okay. Definitely some irregular neurological responses happening here. So,
Dull.
good, okay?
Dull. Sharp. Sharp.
Okay.
Dull. 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 Sharp. Sharp. Dull.
Okay. So you're definitely having a lot of numbness in the mid to lower back. And so that corresponded to the texture. I also would like to do a warm or cold test. So I have this hot pad right here. And I'm going to go ahead and put it on your back. And I want you to let me know if you feel the warm sensation.
Yeah, that's warm.
Okay, good. And then is this warm or cold?
Oh, that's cold.
Okay,
Yeah.
very good. So go ahead and say warm or cold.
Cold.
Okay.
Warm. Warm. Cold. Cold. Warm.
Okay.
Cold. Warm.
Okay.
Warm. 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 I can't really feel.
Okay. I think I'm starting to get a good idea of where the issues are centralizing.
Yeah, maybe like middle. I'm feeling.
Right in this area here. Okay. So right now I'm going to be paying attention to the upper area of the back, your deltoid and trapezial muscles. I know the pain is here, but many times whenever we strain something during an activity that's as complex as dance, the pain could stem from this area and you could feel the pain in a lower section. So it can be very tricky, and I just want to rule out that you're not having any extra tension in the upper parts of the body.
Okay.
Okay, so first I want you to try to touch your right shoulder to your right ear. So if you could just turn your neck. Very good. Okay, and just if you could hold that. I'm just going to be palpating here. I'm just feeling for any muscle mass or protrusions. Okay. Feels normal. Do you have any difficulty in doing that?
No.
Yeah, it's not the most comfortable pose to hold, but I'm just making sure you're not having any sharp pain. Okay. Okay, you can go ahead and bring your head up to center. All right, and go ahead and do the opposite side. Let me know if you feel pain. I'm not feeling anything abnormal. Your curvature is normal. And a lot of people your age carry excess tension or begin to carry excess tension in the shoulder area, but you are very much not the case with that. So I have to commend you on whatever your physical fitness routine is. You have a very nice relaxed posture.
Thank you.
Okay. All right, go ahead and bring your head up to center and relax. Okay. Can you touch your chin to your chest? Just go ahead and bend down. I'm just looking for signs of scoliosis here. Okay. A little bit of tension here on this left side, so I'm going to write that down. So I'm going to be working on that in a bit when I do the massage therapy techniques, but it's not too bad. Okay, now try to look up. Can you look all the way up at the ceiling? Okay. Okay. And that's pretty easy for you to do?
Yeah.
All right, go ahead and go back to center. I'm going to be just assessing some of your strength here. Okay, so I'm going to put my hand right here on your right shoulder blade, and I want you to try to twist against my push, okay? So try to turn your body to your right in 3, 2, 1. Okay, good. All right, let's do the opposite shoulder. 3, 2, 1. Okay, good. I'm going to be placing my hands right here. Try to lean forward. Okay, 3, 2, 1. Okay, good. And try to lean back. 3, 2, 1. Okay, excellent. So any difficulty in doing that?
No.
Okay, I'm going to be placing my hands right here on your arms. Try to lift them up squarely, okay? 3, 2, 1. Okay, very good. You can rest. All right, so your strength seems to be very good. All right. I'm going to be percussing down the spine, okay? So you're just going to feel a light tapping sensation. I'm just judging for normal reflexes to make sure you don't have any edema. And I'm checking for fluid retention here. Okay. 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 Feeling normal reactions. Okay. So what I'm going to do next is I'm going to take the surgical marker and I'm going to mark the certain discs of the spine in the midsection where you say the pain is stemming from, and I'm going to use that as a center point to measure to the sides of your back, just to measure for symmetry, okay? So you say the pain is originating around this disc?
Yeah.
Okay. Okay.
Yeah, right there is really
Right
sore.
there. Okay. 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 So we have 10.5 on D19. So D20. Okay. That's 10.5 on D21. Okay. I'm gonna do this side. 10.6 on D22. 10.3 on D23. And D24 is going to be 10.2. Okay. All right. Moving to the other side. So we have D19. That's 10. 10 even. Okay. D20 is 10.2. On the left side. D21. 10 even again. D22. D23. 10.3. Okay, so I'm seeing that you're shifting to your right side. And it is to compensate for the pain and the muscle tension. So your spine's a little misaligned, but that's why you're here. I'm going to be doing some therapy to adjust that for you. Okay, just a couple more measurements and then get you lying down. Okay, 24, it's 10.1, okay. Right. Okay. So before we have you lay down, I'm just going to do some preliminary pressure point therapy just to loosen up the sections on either side of the spine, especially in the middle to lower back, okay? So you're going to feel a cold sensation. And I'll follow it with a hot pad too to give you temperature therapy. So you're just going to feel a light massage here. It's going to feel a little bit tense, but you shouldn't feel a sharp shooting pain, okay? Okay, and now the doctor who referred you to me said that you witnessed an alien abduction.
Yeah.
Is that right?
I did. It was about 2 weeks ago.
Okay.
I was driving in the suburbs by the airport and I just saw 2 people get abducted. It was maybe about 50 yards from me. But like I said, I was in my car, so I felt okay. Like I didn't get any radiation or anything. I mean, I don't know what it's called, but it was just really weird overall.
Okay, all right. And did you feel your body seize up at any point during the abduction?
During the abduction, I felt anxiety running through my body
Okay.
really, really highly. And afterwards, I just had a lot of anxiety problems.
Sure, okay.
Yeah, I should
Then
talk to my therapist.
Sure. That's just stress from the trauma of the event. But if you felt any physical seizing up, like a seizure or any muscle spasms, that would be something to be worried about, but it sounds like you are at a safe distance.
Yeah.
So that's
it
good.
is.
Okay. Okay, excellent. I'm going to have you lay face down, and I'm going to be doing some massage treatment on you, okay?
Okay.
All right, you're going to feel a little bit of cold. I'm just going to remove some of this surgical marker, okay? Okay, all right, here's more of a warming sensation here. All right. I'm going to be applying some oil to your back. This is to help alleviate pain. It's infused with menthol and lavender, also rosemary, so it has aromatherapy qualities. And I'm going to be doing a variety of just massage techniques for the midsection. So this is a ball roller, and it specializes in getting out that muscle mass. We'll just try to relax your muscles to be more receptive to the treatment. Okay. I'm going to be applying some more oil. All right, I'm going to apply the hot pads as well. And this will help your skin absorb the moisture. Okay. I'm going to be using a couple of wooden tools on your back now. Okay, so you're just going to feel a wheeling kind of sensation down your back, and you might feel a little numbness in your mid-back, but hopefully that will recede as I continue to loosen up the muscle tendons. And again, let me know if you feel any sharp pain. Okay. And this is a larger roller you're going to feel sliding down your back. Okay. Okay. So before we move on to the cupping therapy, I'm going to perform a neurological test just to see if some of that numbness in your mid-back has subsided yet. So this is a tuning fork, okay? I'm going to be placing it on different discs of the spine and you're going to feel a vibration. Do you feel it?
Yeah.
Okay. And I'll be stopping it promptly. Let me know when it stops. So just say it stopped or stop. Okay? Or if you don't feel it at all, let me know that too.
I feel that. Okay, it just stopped.
Good.
Okay, feel it. Stopped.
Okay.
I feel that. Stopped.
Good.
I feel it. Stopped.
Okay.
I feel it. Stopped.
Good. Wait.
I feel that. Stopped. I feel it. Stopped.
Okay, good. So it looks like your symptoms are showing some improvement. I'm going to be doing some cupping therapy next, okay?
Okay.
So this isn't traditional cupping tools where you're going to get circles on your back. I'm going to be using the cupping tools as a massage tool. So I'll be dragging them from the center of the spine out towards the edges, and this should really help improve your circulation.
Yeah, I'm feeling a lot better already.
That's good. I'm so glad to hear. Okay. Putting more oil on your back. All right. Just repeating that with some different size cups. A little more oil. And we'll be using a larger tool. right now I'm making a circle around that section of your back that is the most affected. Just looking to draw out any toxins that need to be released beneath the skin to simulate healing. So you should just feel the pressure. I'm not staying in one spot for any long period of time because this is to simulate movement. Okay. All right, how was that for you today?
I think that really helped me a lot. I feel better.
That's great. Okay, so I'm going to recommend that you just give it a rest for a while. I like to stay away from over-the-counter pain medications, so if your schedule allows, I'd like to see you again in a week and perform similar therapies. Next time we'll be using a massage gun, and hopefully we'll get your back feeling better, but it should already start to be feeling a little bit less pressurized.
Okay, yeah, for sure. Thank you.
Okay, all right, great. Well, thank you for allowing me to do this treatment on you, and we'll go ahead and end it and get dressed on your own time, and I'll see you out front, okay?
Okay.
Okay.